Thank you for tuning in to Amaris B podcast. I am Dr. Ivan Puah, and I founded Amaris B Clinic in 2004. I am an MOH accredited liposuction doctor and medical aesthetics doctor based in Singapore. I have been trained directly under Dr. Alfredo Hoyos and Dr. John Millard for basal liposuction, Dr. Pierre Fournier for liposculpture, fat grafting, and thread lift. Also by Dr. Delgado for dedicated surgical training in gynecomastia surgery in San Francisco. Today, I'm going to talk about fixing gynecomastia with fat freezing and why is it a bad idea. First of all, I would like to talk about how to check for gynecomastia, like how I do it in the clinic. The pinch test. Put your hand on your breast and try to pinch the tissue around the breast and the nipple. First of all, to ascertain the size and the location of the breast gland beneath your nipple and areola. Subsequently, you have to feel how much and where the fat layers are distributed. And finally, to ascertain how much and the extent of loose skin around the breast. In clinics, sometimes what I have to do is to look for signs and symptoms to ensure that patients do not suffer from any underlying medical condition that leads to or complicate the matters. Gynecomastia is a common issue. It may affect up to 60 to 70% of adult male. And that's the reason why lately we have been fiercely swarmed with advertisements promoting various treatments, including fat freezing to tackle enlarged male breasts. Does it work? Is it possible to treat gynecomastia with fat freezing? Fat freezing is a non-invasive fat treatment that reduces subcutaneous fat beneath the skin. Fat freezing is not specifically designed to target or to reduce glandular breast tissue in cases of gynecomastia. While this non-invasive treatment may reduce some chest fats over multiple sessions, it is not considered the primary treatment for gynecomastia. Worse still, there are side effects of fat freezing, such as pain, swelling, irritation, uneven contours. Last but not least, paradoxical adipose hyperplasia or PAH, which causes abnormal thickening of fat cells after fat freezing. In the worst case, if the fat is reduced or flattened by fat freezing, leaving behind significant breast tissue, this may make their chest look even worse than before. Lately, we do see a lot of advertisements and social media talking about and endorsing treatments for gynecomastia, as gynecomastia treatment itself is getting a lot of attention from the media lately. However, please approach these endorsements, advertisements, and recommendations with caution, as they often mix facts with fiction. Please do your own research, speak to doctors who does gynecomastia before you make any sound judgment. Thank you for listening. I hope you enjoyed the podcast today. If you do have any questions, please feel free to send it to us. We'll be glad to answer all of them. See you again.